Testing, testing.
Yep, thank you. Oh, you're talking about. I got you. I got three.
1 2 1 2 1 2.
I don't have hands for it. The lip on this thing is too small. Like, yeah. Where'd Eric go? We've got a lot of these. Yeah, we've got 6, but I think there's a couple extras. Hey, Andy. Except for that one. Wait, I turned it off.
Hello, hello.
All right. All right. Good afternoon, everybody. Thanks for coming. Thanks for accommodating the little bit smaller room as we get I've been moved out of Timmerman for the afternoon. So we're in this room, and then we're broadcasting across to the Anchor Bank room. Our panel for the medical sales certificate, medical marketing and sales certificate is standing by. Thank you for standing by. We'll get with them shortly. I do want to go through the winners for this afternoon's competition. First off, thank you very much to Steinhoffels for the event. Appreciate it. Thank you to the rest of the partners that came out and supported with judges and buyers and being here. And we can't do these things without you. And I know I say that all the time, but we really appreciate all of the support. I want to take a second and shout out to Jack Onis and Alex Brokaw and the rest of the sales corps that helped me out today. I'm here by myself today. Jimmy and I are doing this one on our own. So we're down a couple of people. And and those guys really came through for me. So thanks to the sales corps for helping put this thing through. So we've got 6 winners, 6 first place, 6 second place in the beginner room, and then 3 and 3 in the advanced rooms. So Luke's going to hand out certificates. When I call your name, come on up. We're going to get some pictures from you guys, and then we'll get into the panel discussion. All right. So first off, second place in the beginners room, Emily Morales, Selena Artiega, Riley Marango, Kayla Grabowski, Spencer Wiersma, and Maisie Dabson. Come on up. We'll get a couple of pictures. All right. All right. Congratulations, folks. Appreciate it. First place in the beginners' rooms, Nina Albertini, Sabrina Wanek, Paige Moeller, Tori Slama, Kiefer Besterfeld, and Sam Maines. And I know a couple of these aren't here, so I good question. Jimmy has surprise money. It's $100 for second place and $125 for first. So yes, or a tank of gas, either one. All right, congratulations. So second place in the advanced room, Emily Thatcher, Brianna Keel, and Lauren Seidel. All right, and last but not least, first place in the advanced room, Taylor Wojcinski. Sorry, I actually practiced that earlier too, just in case. Gracie Hughes and Michael Van Offeren. All right, one more round of applause for Steinhoffels. Thanks a lot, you guys, for putting this together. We really appreciate it, and congratulations to everybody that competed, and those of you that placed in your rooms. Congratulations again. All right, there'll be a slight pause, and then we'll get started on the panel discussion. Thank you.
All right, we're gonna get started here.
All right, thank you all for coming to today's medical sales and marketing certificate. Okay, sorry about that. Thank you for coming today. Just before we get started, here's a quick little lineup.
So if you didn't know, Gracie, our president, is on homecoming court. She made me announce that she was embarrassed. But today we're going over the medical sales and marketing certificate with Dave. And then we're going to go over our member of the week and then just any updates and upcoming events. So it'll be a fun day.
Yeah, so with that, we're going to welcome our partners and then hand it over to Dave to get our panel discussion started for today. That one, I'm gonna hand.
Grab a seat, guys. We have enough chairs? 1, 2, 3, 4, 5. Okay. All right, just 1 second. We've got a extra partner joining us online. So we're just gonna get that set up real quick. She's there? Okay. All right. May is with us. So welcome everybody. Panel discussion this evening with a variety of people from a variety of industries actually, but all focused or centered or somehow interacting with the medical field. So we've got a company that does pharmaceuticals. We've got a company that manufactures device. We've got a tier 1 manufacturer, which somebody will explain along the way. And then we've got a distributor with us. So we have a pretty wide selection looking for some pretty good answers to these. We're going to start off by giving each of you a chance to introduce yourselves. And in a minute or two, tell us a little bit about the company, what you guys do, how it's related to the field. Grant, you want to go first? Oh, we've got an order. All right. That's right. I have the order. Taylor, do you want to start? All right. And welcome back.
Thank you so much. Thank you so much for having us. So just a brief introduction for myself. So I'm Taylor Shaw. I'm the Midwest sales representative at Prent. Tyler and I actually joined right out of college. We both went to UW Whitewater. So we both started around the same time. So we're about 2 years full-time currently. I don't know if you want to give an intro for yourself as well.
Sure. As Taylor said, I'm Tyler Evans. I'm the Mid-Atlantic sales rep for Prent, so I cover Ohio, Pennsylvania, down through the Carolinas. Been with Prent for about 2.5 years. We both graduated in 2022, as with Grant, I believe, as well. So good to be back. A little bit of a background on Prent Corporation. We are a custom thermoform packaging manufacturer. We're headquartered out of Janesville, Wisconsin. Guarantee you there's like 5 people in here that maybe know what thermoforming is because we told you guys at the career fair, but it's all right. So we actually manufacture plastic packaging that companies like Diversetek and Schein utilize in their medical devices to keep sterility and everything there. So we do all of that out of Janesville as our headquarters. We are a vertically integrated company, so we have a sister organization who you guys may have seen here before as well. Their name's Goex Corporation. So we're owned by the same family. We operate different, but they are one of our main suppliers. And we do have a private ownership. So we were founded in 1967 and are still currently owned by the same family, operating under a 3rd generation of leadership. So if you want to go to the next slide, this is just a kind of a mess of a map, but it's an overview of our facilities. So like I mentioned, we're headquartered in Janesville, Wisconsin, so about 30 minutes south of here. And then we have facilities that we manufacture out of in Flagstaff, Arizona, Tijuana, Mexico, El Paso, Texas, Costa Rica, Puerto Rico, Denmark, Shanghai, and Malaysia as well. So we're a global company that manufactures the same products at all of our locations. Go to the next slide. This is a little bit of a breakdown of our sales territories. As you can see, Taylor is the Great Lakes / Ontario, so that peach color, and then I'm the gray color right next to it in the Mid-Atlantic. We are currently hiring for territory sales reps as well, so looking for full-time sales representatives to join. It's a full outside sales position, and you would be likely splitting that Southwest Central Mexico territory for now. But that's a little bit of a background on Prent.
All right, fantastic. We're going to slide over to Grant from Schein.
Hey guys, like Tyler said, I did graduate from here 2022. That makes me feel really old. And this is honestly, these are a lot of the answers to the questions, so we don't have to go through the slideshow as much. But what Henry Schein is we are a healthcare distributor. So I can really only speak on the dental aspect of the company today. If you have further questions about medical throughout or at the end, feel free to come to me at the end of today's meeting. And I'd be happy to talk to you about that, get some questions from you guys. I might not have the answers right away, but I can for sure track those down for you guys. Unlike Prent, we're at the very other end of the supply chain. So we are one of the last, if not the last aspect of supply chain. We are the distributors. So we don't make any of the products ourselves. We do have a private label, but that's just contracted off to somebody else, a different manufacturer that we just slap our name on. So we don't actually physically make any of the products we distribute. I'm the person who's going into dental offices, speaking to doctors, seeing what their needs are, not only on the supply end, but business solutions as well. We cover a wide range of practices. So we operate in over 32 countries. I believe we are over 28,000 employees now. Here in the United States, we have over 1,000 FSCs, which is what I am, a field sales consultant. And we've been around for over 90 years now. In the 60s, we got into dental, but we are the only medical and dental distributor in the country. There's talks of whether or not that'll last for very long. We have a lot of private equity-backed companies starting to purchase distributors like ourselves. So we might have some competition in that landscape. But that's a little overview of what Henry Schein is and what we do, and looking forward to today's discussion.
All right, Grant, thank you very much. We're going to jump down to the other end now. And as Grant pointed out, we've done both ends of the supply chain now. We've done tier one supply, we've done distributor. We're going to jump back into the middle, right? And Amanda and Tim with Diversetek.
I'm Amanda. I also graduated in 2022, not from here though. We are actually both grads of Wisconsin Lutheran College in Milwaukee, coincidentally. So I do HR, so I'm not in sales, but I do sell our company to students like you to fill roles like our internship or entry level or other opportunities as well. Yeah, so Diversetek, we're a medical device manufacturer. So we actually do, he was saying they distribute, we actually do the manufacturing in-house at our corporate headquarters in Milwaukee. We also have a few other locations that do manufacturing. One in just outside of Denver, Colorado. And then we do have manufacturing also in Vietnam. We're a small to mid-sized company. So you saw their maps. We don't have quite as many locations as they do. Main locations in Milwaukee, Wisconsin. That's where our internship and entry-level opportunities would be located. I mentioned Denver. We do have a location out there. Smaller location, they do more of our specialized devices. We specialize in gastroenterology or GI surgical devices and diagnostic testing as well. So in Milwaukee, we're doing more of the routine devices. One of the most common is like an esophageal dilator. Whereas Denver, they're doing higher tech disruptive technology that can diagnose different disease states in the esophagus. And then we do have another company under our parent company of Diversetek, Sunlight Plastics in Germantown, Wisconsin, so pretty close to Milwaukee. And they manufacture the medical grade tubing that we use in Milwaukee in our final assemblies, as well as distributing to other medical device companies across the United States as well. That's a little overview. I'll let Tim introduce himself and maybe talk more about the sales side.
Hello, everyone. I graduated college back in 2008, so I'm ancient to all of you. Been with Diversetek since 2010, and I started out as an associate sales rep, so an entry-level sales rep, transitioned to a hybrid rep, which covers territories of the United States that we currently don't have outside reps in. And then I transitioned to the inside sales manager, I believe, back in 2020. So as a smaller company, I like to think of it as we're a small company that does not have the disadvantages of a big company. So we're not privately, or we don't have investors. We aren't controlled by a group of those investors that are only looking out for their own benefit. We don't have any debt, and our owner is constantly reinvesting in our company. So as an employee, it gives you a really great feeling that, you know, our owner and the people that are executives of our company care about the employees, and they care about our company's longevity. So again, being a small company, it does bring its advantages, One of the disadvantages I would say is we don't have as many outside sales reps as we would like. With that being said, it is looking like we will be expanding in the near future, which means there's going to be positions open, meaning entry-level sales positions as well.
All right. Thank you very much, Tim. We're going to jump to joining us virtually is May from Ardelyx. May, tell us a little bit about your organization.
Hi, everyone. My name is May. I am the HR business
Hang on one
partner.
second.
Okay,
We've got no sound at the moment. Hang on one second.
no problem.
I think you might be muted. Can you check your microphone real quick?
Let's see. Can you guys hear me now?
It might be, I think it might be a microphone setting thing on May's end. So we're gonna let
Can
her
you guys
work
hear
on
me?
that for a second. Hang tight.
Can you guys? How about now? How about now? Let's see.
Yeah. May, unfortunately, we can see you trying to talk to us, but we can't hear you. So
Hello? Hello? Let's
maybe
see.
log out and jump back in.
Hello?
Oh,
Can you
we
guys?
can hear her in the overflow room. We just can't hear her in our room. Sit tight.
Oh.
Apparently it's on our end. Hold on.
Okay.
All right, we might have it.
Can you guys hear me now?
It's hang on, the computer is thinking about clearing the screen.
Yeah, you guys broke up a little bit. Did you say you can hear me?
There we are. Yeah, we can hear you. Do you got us okay?
Yep.
All right, May. Now that we can hear you in this room, in both rooms, go ahead and share a little bit about Ardelyx with us and your position there.
Okay, great. Hi, everyone. My name is May. I am the HR business partner for commercial here at Ardelyx. So Ardelyx was founded with the mission to discover, develop, and commercialize innovative first-in-class medicines that meet significant unmet needs. We are pharmaceuticals, and we have 2 commercial products approved in the United States, one being Ardelyx, focusing on IBS-C, and then our second product is Xphozah, focusing on patients with chronic kidney disease. We are a mid-sized organization headquartered in Waltham, Massachusetts. However, we also have offices in Milwaukee, Wisconsin, and Fremont, California, as well as a robust remote team and sales force. And we do focus and we have opportunities for students just like you. We actually have a few UWW alumni specifically as part of our Milwaukee office on our inside sales rep team. But we do mainly focus on internship and permanent placements.
All right, fantastic. Thank you very much for that. So questions. Here we go. This first one, May and Amanda, I'm going to come back to you on this first question in a little bit different form. So sit tight on that because I've got an HR related version of this question. But for Tyler or Tim or Taylor or Grant, wherever you guys want to start, in your mind, how is healthcare medical unique or different from other industries?
I'll go first. So from our perspective, it's a lot different than other industries based on the regulation. So everything that we do from a manufacturing standpoint is done in a clean room. So everything we talk about is sterile product, and we're working with companies that are manufacturing in clean environments as well. So just understanding the regulations of that and being able to articulate that to our customers. Taylor and I work mostly with engineers. So we work with packaging engineers who don't have any sales background, and frankly, Taylor and I don't have any background in packaging engineering. So we're working with people in different aspects that really don't want to work with us, to be honest. And it's just a very regulated industry to work in. So we need to be able to maintain that.
Tyler, what's a clean room?
Clean
In
room
1,000 words or less.
Is a controlled environment that you have to gown up, wear specific shoes, hairnets, gloves, all the fun stuff, and it filters particles, depending on the class of clean room to a certain extent per million. Really clean space. You can eat off the floor.
Thank you. Very good. Taylor, do you want to add anything to that one?
Everything Tyler said to a T. Another differentiating factor for the type of sales that we do is the sales cycle itself. It's very long. You know, our standard cycle is around 12 to 18 months, can really vary. So we really work with our customers directly from inception of an initial concept, working with them all the way throughout that project, kind of being the middleman between our design team and our quality team, to Tyler's point, staying on top of regulatory. So it's a very extensive cycle as well. It's not nearly as transactional as you'd see other types of sales. So yeah, it was an additional point there.
All right, fantastic. Amanda's pointing at you, Tim.
I'm in trouble. So our reps are seeing doctors or physicians every day. So you're thinking of hospitals, endoscopy centers, surgery centers. One of the things that separates us from a lot of other industries or companies is going to be the credentialing aspect of reps getting into these facilities. You can't just show up at a hospital and say, hey, I'm going to go see, Dr. Martin, and okay, yep, second floor, go see him. He's waiting for you. There's a lot of restrictions. There's a lot of credentialing aspects that go into it. As a rep, in order for you to get into a certain hospital, you might have to pay $400 to $500 to be credentialed for a year. And you're going to have to go through a series of material, quizzes, tests, make sure that your immunization records are up to date. So it's a process that is a bit different from a lot of industries. The other big difference is going to be that our end user is the patient, but we're not selling to the patient directly. We're selling to the physicians who are using our products on the patients. So we really care about the patient, obviously, and what we're aiming for is to improve the efficiency for the physician, but improve the efficacy for the patient, if that makes sense.
Interesting dynamic, right?
Sure.
To have two completely different users of the same product, one that you can communicate with directly, one that essentially you can't.
Yeah, and to your point, when you're in procedures as a rep, you're you don't really have interaction with the patient. Some of the times the physician that's in the room will ask the patient who's just about to go under, hey, do you give permission for the rep to be in this procedure?
I'm going to stop you real quick because I know what you're talking about, but can you explain what you mean by in procedure as a sales rep?
Yeah, for sure. So our products are obviously used by the physicians on the patients in the procedure. You as the rep will want to be in that procedure just to ensure that the physician is using your product properly. There's different nuances with every product, as I'm sure everyone can attest to. So you as the rep want to make sure that things are going smoothly. And let's say the physician, he or she is maybe not using it properly. You want to be able to walk or help that physician say, hey, I think maybe this is how you should rotate or how you should use it or hold it.
Yeah. So in the surgery theater, while the procedure is being done, right? Like I learned this years ago and was like, well, there goes medical sales for me. I will not be doing that. So it's just a different aspect of the industry.
And another big difference between Diversetek and being in the GI space, surgery as well, is most of the procedures that our products are used in are only going to be 30 to 45-minute procedures. So you have someone that's, just an OR or trauma, some of the other departments, these procedures are going to take upwards of a few hours or longer.
Sure. Thanks. Grant.
Yeah, I would say
for you guys,
differentiator of healthcare marketing and sales in comparison to some other industries is the major focus shifts from sales specific to education and regulation. So these guys from Prent, they hit on regulation pretty hard. There's a lot to that. But then that educational piece too, which Diversetek hit on, that's definitely a huge differentiator. You're really more so educating and understanding and teaching about the regulations as well, because at least in my particular field, doctors didn't go to school knowing the specifics of a product. They just went to school of how to use said product, but there's thousands of different kinds of products and differentiators between those products. So luckily for me, in the more of the distribution role, I have to know a little about a lot, and I get to say, that's this person you want to talk to, or that's this person you want to talk to. And I don't have to know the nitty gritty of each individual product that we distribute. Thank God, because that's over 300,000 products. But the other thing is, in this position, something that's different is I'm not really a salesperson. I'm more of a business person, which is great because that's what I went to school for. It was sales as an emphasis, but we here at Whitewater, they do a great job of getting you in finance and in marketing and in pretty much every aspect, economics of business. So that's one neat part of my job is I get to help the doctor understand his or her practice, how to grow it, if they're going into retirement, how they're going to sell it, how insurances work. So we have to know a little bit about a lot, but biggest differentiators I would say in the healthcare field is the fact that you're more of an educator, and you have to know those rules and regulations. It's massively regulated. Probably no other industry is more regulated than healthcare.
All right, we'll get back to the regulations and some of those challenges in a little bit. May, I want to come up to you, and then Amanda, the question will jump from her to you in a second. But May, I want to give you a chance to talk about the pharmaceutical industry and this question of how is that industry uniquely challenging from a sales and marketing standpoint?
Similarly, like everyone had said, it's really about the regulations. Every industry is very different, and even when it goes to medical devices to pharmaceuticals, the regulations are heavily different, especially when you're dealing with commercialization of organizations. So I think that's one of the biggest aspects of it, whether we're doing in-house products or external products as well. And then other challenges that are very specific to, what Ardelyx does in terms of sales and marketing, is that we're not directly selling to patients. We're working through healthcare providers. And so our sales team is out in the field constantly visiting doctor's office. And so you don't actually get that patient, that direct patient experience, but it's equally as impactful.
All right. So May, I'm going to stay with you, and then we'll jump down to Amanda. Tim touched on this a little bit when he talked about credentialing. From the HR standpoint, what is different about looking for sales reps, looking for marketeers for your industries?
So it's definitely having the experience within the pharmaceutical biotech industry is really big. Medical devices is also relative at all, as well. We focus on the GI space and the nephrology space. So we're really looking for particular sales folks that have experience in those sectors, particularly because the markets are so different across sales and then also marketing as well. And so you're dealing with different external faces and internal faces as in particular, and that's kind of what we're looking for.
All right, Amanda, I promised. From the HR viewpoint, what's different about the industry?
Yeah, we should already talk about credentialing too. It's kind of that comes partly on me to set it off with, background check, drug screen, all that stuff. And let's get very nitpicky. So that can be a little annoying. But on like the hiring side of things, kind of depends on what level of sales or marketing we're bringing somebody in at. For what we require for their experience. If we're hiring interns or like entry level college graduates, we're not expecting you to have worked in medical before or had experience with GI specifically. That's why we start our training or our sales employees in an inside sales role. So we can train you. We know that we're teaching you correctly. You know what you know. And then we kind of have a growth track there. Tim mentioned it earlier. Reps can then either grow into like a hybrid role with more travel, a little bit greater responsibility, and or outside to the field. So for field roles, we either will promote from within because we know that we've trained them correctly. They know what to do. They understand our products well already. Or if we're hiring someone that hasn't worked for us before, looking for at least like 1 to 2 years of experience in some sort of medical field. Doesn't have to be GI. We've had people come from pharmaceutical. We've had people come from like orthopedics, trauma, things like that, or dental as well, and do really well. Just to know that a candidate can, or an employee, it has the capability to understand different medical things. They should be able to pick up GI a little bit smoother than maybe someone coming from paper sales, for instance. It's a lot different. I know I'm going Dunder Mifflin. First time that came to my mind. That's very, very different product selling and who you're selling to and how you're selling it than being in medical. There's a lot more you have to know and be able to comprehend or understand. So yeah, it kind of varies by the position, what the requirements are and preferences for bringing somebody on and what level experience.
So I'm going to come to you, Grant, and then we'll work our way down. But Amanda touched on something really interesting here. How hard is it to get up to speed in that industry? You mentioned 300,000 products and not knowing a lot about any of them. I know where Tyler and Taylor started was nobody in this room knows what we do, right? So let's work our way down. Grant, how hard is it to get up to speed, or what advice would you give to somebody who is not in medical or bioengineering studies but finds this field interesting?
Yeah, it's a great question. If you're wanting a timeline of how long it takes, 2 years, 7 months plus. And honestly, I told myself when I graduated, I wanted to be in a position that I would be learning something new every day. And I'm regretting saying that a little bit because that's going to be the case for at least the next 10 years. Just when I think I've got something, it changes, or we no longer do that, or we no longer distribute that product. So as far as how long it took for me to feel comfortable and confident in speaking to doctors about their overall practice, realistically, I'd say about a year out in the field. A lot of my colleagues told me it'd be 2. And this being October, it's exactly 2 years for being out in the field for me, 2.5 with the company. But every single day I am learning something new. So medical, healthcare in general, it will forever be changing. And that's a great thing. I mean, think about us as patients. We all go to the dentist. Well, we hopefully all go to the dentist. I'm victim of not going to the doctor a ton. I try to stay out as much as I can, but in one way or another, we end up finding ourselves involved with healthcare, and thank God it's evolving. If you look at dental just 10 years ago, completely different landscape. So, I'll hit on being adaptable later in the discussion, but it takes a while, and that's okay. When people look at me, they have the patience and understanding that, yeah, he's new, and it's going to take them a little bit, but they're willing to give me a shot. It's like drinking from a fire hose if you've not heard that before.
Taylor, Tyler, whichever one of you wants to pick this one off.
I absolutely agree with most of what Grant said, everything that he touched on. It's Tyler and I think Tyler would agree with me. We are also learning something every single day. And something different about Prent is that we are a custom manufacturer. So there's even more fun, new, different, exciting projects and different situations that'll occur throughout the day that we need to quickly react to. And a lot of the times there's a lot of new situations that occur. It's not a lot of black and white when you are a custom manufacturer. There's a lot of different products that we accommodate in terms of our packaging. So there's a wide variety that we just intake a lot of information throughout the day, and a lot of Grant touched on this earlier as well. A lot of, hey, don't have all the information for you in terms of the quality requirements. However, that quality engineer specific to that account is able to kind of step in, provide their expertise on the matter. So we're learning stuff every single day, and it's still active, but I would say you really get comfortable in the role once you're about a year in out in the field. When you're getting in front of customers, you really get a lot more comfortable and more confident in terms of what you're selling. I don't know if you say anything else.
Good. Tim, what do you think? 14 years with the company now, right? Did I understand that right?
Yeah, so it takes about 14 to fully understand.
At least 14.
No, I mean, I think, Grant hit it. We don't obviously have 3,000 products, and that's a whole different beast. But we generally tell our entry-level sales reps it's about 18 to 24 months before you're fully going to wrap your arms around what the industry is, how to have professional conversations with doctors, and how to have those higher level conversations. A lot of these doctors, they're obviously working at a hospital, but they also own with other doctors endoscopy or surgery centers. And now you're having a professional conversation about what's most important to them and how can we save your center money, but still provide you with these, great products. So I think Grant mentioned it, you're, drinking from a fire hose. That's probably pretty accurate. And we try to do a good job of training our reps to just not try to think that you can know everything right away. And I think the biggest thing for me, for college students, just, graduating, coming into the role, and I've mentioned this probably to a few of you, but have a learner's heart. So don't think that you shouldn't learn more, and if you think, oh, I know everything, trust me, you don't. So that's the probably one biggest piece of advice I would give.
Thanks. I'm actually going to come back to something you mentioned in a second, but I want to hear from May as well. May, what your industry, pharma, way different than device and distribution. What do you see from your view as far as ramp up, onboarding, time to come up to speed?
Yeah, like it was said earlier, it really depends on the role. For our field team, the sales folks that are out in the field really pushing our products, we're looking for people with experience. So when we're onboarding, bringing them up to speed from new hire, there is about a month to a month and a half of a period where they're doing at-home study, learning as much as they can about the product that they're specifically focusing on. And then a 2-week process where they actually come in with all of the cohort that they're actually hired with, and they're doing in-person sales training. So they're walking through all different scenarios, talking about the products in all different cases, and then getting certified on the actual product before they go back out in the field. And then there's a lot of, field rides with their zone directors before they really get to go out on their own. But it all really depends on the type of role, whether you're in marketing or whether you're new to sales. We also have, that's really where our ISR team, our inside sales rep team, really come in handy, where, you know, we're taking people that are coming from different industries or new to sales, really giving them time to learn in this hybrid approach on, you know, what the product is, how to work with medical professionals, how to field calls, and then they have the opportunity to kind of go into a hybrid role before they get the opportunity, or they have the opportunity to go into full sales roles.
So thank you. I want to touch on something that Tim mentioned, kind of in two parts, and either Tim can take this or somebody else can pick it off first. Tim said, you can't know everything right away. Long-term sales, business to business sales, we often, as Grant alluded to, end up in situations where we just don't have the answers. However, in the medical field, compliance and accuracy, listen, I sold light bulbs for Granger. Okay. If I got it wrong, they just sent the light bulbs back. Talk to me a little bit about the extended challenge of compliance management and how you handle the, you know what, I just don't have your answer right now types of conversations. And either wherever you guys want to start.
Yeah, that's definitely a tricky part. I think the biggest thing for us and in the medical industry with regulations, we talk a lot about confidentiality. We sign non-disclosure agreements with almost every single one of our customers. So going into it, being in a sales meeting, like you may think, hey, I've got something I'm going to say that I think is going to wow this person, but that could actually be completely wrong. And could be like you're talking about their competitor and now they have trade secrets, all this fun stuff. It's not really that intense, but understanding like if you don't have the answer, it's better to say, let me get back to you. I know someone on our team that can get this answer for you here. I'll have an answer by the end of the day, instead of going in there and coming up with something on the fly that could end up hurting you in the long run. In our realm of sales, with how long our sales cycle is, it's okay to take that time. And I think in the medical space, specifically, it is not as fast paced if you're out there, you know, knocking door to door selling solar or something like that, which it's going to be fast paced, a 12-minute conversation and the deal's done. As Taylor said, our sales cycle is about 12 to 18 months. So having that time and saying, hey, I don't know the answer to your question, but let me find someone that does, is super helpful. And honestly was probably the hardest thing. I'm sure you can attest to it. My first couple of like individual sales calls, I'm like, got this. And you learn very quickly that saying that I don't have this is actually the right way to go.
Grant?
Yeah, I just want a quick sidebar. I promise I'll answer the question, but I meant to ask this in the beginning. How many of you are at least interested in some capacity in healthcare? And not just necessarily medical, but healthcare. Raise them high. I'm just curious because I know some of you are here just for class. All right, now like raise it real high if like, that's what I'm going to do. That's what all right, good portion still. That's good. Just was curious because I know there's a mixed bag in here. I was in those seats as well as we all were. So some of you are probably like, I could give a rat's about this, right? So, but to answer that question, that's a very good point. I think the Sales Institute here does a fantastic job of being as realistic as possible to the real world. But at the end of the day, there's a rubric, right? And a part of that rubric is, did they close? For those of you that did the competition today, hopefully you did close. But in the real world, I want you to know that, like Tyler said, you really shouldn't BS what you don't know. And the lesson that is to be taught here is be comfortable being uncomfortable. And I used to teach that when I was here at Whitewater. And by that, I mean, it's uncomfortable to say, hey, doc, or hey, whoever it is that you're talking to, I don't have that answer. That's uncomfortable. It's your job. You feel like you should have it, but it's way better to say, I don't have that answer. I sure can get that for you. But in this moment, I don't have that for you. Got to admit it when you don't know it. Move on from that. It's way better than BSing because you might find yourself in a trap. You might lose your job, quite honestly. I mean, that's the real world. It's not necessarily about closing in that moment. Yeah, that's important. You want your sales. We're all salespeople for those of us that are going into sales. But I would say it's important to also be paying attention to the ever-changing environment of the industry that you're in too, whether it be healthcare or not. It's kind of funny because I do OSHA training for my offices and some people go, what makes you certified to do that? And I go, I have no idea. No, just kidding. I had to go through a separate certification for that. But it's funny because everybody goes, oh, OSHA. I have to do it every year. Doesn't matter if you're a receptionist, office manager, doctor, hygienist, assistant. Everybody has to do it every single year. And they'll go, oh. And then about 30 minutes into the 2-hour long meeting, it's a long one, people start going like this and, oh yeah, that's good. Yeah. So you might think you've got it, but it's always good to have reminders. Swallow your ego would be another big point of conversation I'd like to make too.
Swallow your ego. Salespeople across the universe just got very nervous when you said that. Jim, what do you think?
Not a lot for me to add. I think it just speaks to your character and integrity. Don't lie to the customer just because you want to get that sale. Eventually, it's going to come back to bite you in one way or another. And just letting the physician know, doc, I don't have the answer. I'm relatively new. I probably should. I apologize. Let me get that answer for you, and I'll get back to you as soon as I can. It's much better than telling the physician something wrong. And then what happens if the physician takes that wrong information and, heaven forbid, something happens in the procedure? Then it's no good for anybody. So again, I think it just speaks to the character and integrity. It's almost like you want to do what you're doing when no one's watching. And that is very important.
Excellent. Thank you. So, marketing and sales in slightly different ways are both about building relationships, right? Long-term sales, business to business sales, about building relationships. We can start wherever you guys would like. Talk to me about acquiring new clients, building long-term relationships, specifically in your industries.
I mean, for me, the biggest thing in terms of acquiring new clients and building new relationships, like we mentioned, long sales cycle, you're going to spend a lot of time with your customers. For me, the biggest thing that I've seen help is to just be genuine with my customers and actually like care about who they are as a person. I'm not going into my initial business meeting with a prospect being like, I'm closing them today. That's always the intention, but it's always like I actually want to get to know, if Dave's my client, I want to get to know Dave. I want to know his family. I want to know his past, what he's done, and learn from him, because 95% of the time the people that we're talking to, I speak for myself on this, are far smarter than I am. And I want to learn from them to continue to grow in the industry. So I think for me, building relationships just really comes from being genuine and being like personal with your customer. Like, all my customers know my wife, all my customers know my pets, and I know most of my customers' pets. So just being genuine with our customers is really big.
Excellent. Tim, Grant?
I mean, for myself personally, this position is more of an account management position in all reality. Whereas I'm not prospecting new business as far as new practices or new doctors go. Obviously, I'm prospecting new business within that practice for opportunities. But my roster is a set roster. Occasionally, like just today, I had a doctor purchase his third practice. So I'll be absorbing that practice that he just purchased and its staff. But as far as creating a long-term relationship, I would say that in addition to all the answers of the first question of what separates us from other industries, that's a big one. I don't know many healthcare companies, if any, that it's kind of a one and done deal, like a car salesman, it's a much different sales cycle and sales type. I've won a ton of competition by truthfully just caring, like you said. I will always make a point to not just rush to the back and talk to the doctor, but talk to the receptionist, talk to the office manager. And I finally had the receptionist go, your competition, they never stop to say hi. They don't know my name. They could give a crap about what my name is or if I have kids. And they go, and the funny thing is I'm the one who makes the decision at this office. And because of that, here's a business. I mean, said differently than that, but just showing and being genuine, it's huge. I know sometimes it's easy to have some kind of facade or different personality as a salesperson. But if you feel that sales is right for you and it's something that you enjoy, you just got to be genuine. The tactical stuff comes in time. But I would say in creating those long relationships, it's all about being genuine.
Fantastic. I'm going to see, May, do you want to tackle this one from the pharmaceutical side?
Yeah, absolutely. So when thinking about building relationships with customers, again, our customers are not our direct patients, they're with the HCPs. And so it's exactly what, our other panelists are saying is being genuine, building good relationships with our providers, visiting often. It's not just a one and done deal. And what we're really focused on as a mission as a whole is just bringing on good people and having being proud of our mission and truly believing in it. You know, we're constantly challenging our providers to think more, to do more for their patients. And it's not just about, you know, hitting the adequate phosphorus levels for our product. It's why not make it even better? Why not make them even lower? How do we get them so that their long-term care is changed and that habit actually sticks? Why don't we make their, you know, long-term life even better? And so it's not just stopping there, and it's constantly building on that. And so building those relationships, making sure that you're there for luncheons, speaker programs, just making sure that, you know, exactly what they said, you know, talk to not just your provider, but, you know, the person at the front desk, learning about, you know, the office itself, the type of patients that they care for, you know, those long-standing relationships too. That's how you really build long-term customer relationships with our clients across the board.
All right, thanks. Tim, you want to tack onto this one? How do you build long-term gastrointestinal doctor clients that don't want to see you and make 10 times as much money as we do?
Exactly. A lot of good points. I think most were hit. Just a couple points I want to mention. Relationships are the lifeblood of our business. Without them, you can't succeed. I forget the percent, but it's over 90% of most sales are closed after the 12th follow-up. So if you think about it, you're not going to walk into an office and close them on the first try. You know, you might, I think we were talking about, you might think you're that good. You're not that good. To Grant's point, everyone you meet should be your customer. Front desk person, janitor worker, I don't care who it is, because you don't know the influence or the pull that they have. And plus it shows that you actually care. So a couple things I ask my reps, you know, do you care about your customer? And are you being transactional or are you being consultant? So those are kind of some of the takeaways. But to a bigger point, your customers want to buy from people that they like, people that they trust, and people that care about them, not just caring about themselves, not just caring about the next sale. And so it's so important to build those relationships, because I've seen firsthand when those relationships are formed, you walk into an office and the person that's making the decision says, hey, we have business for you. We don't like this current rep, and because we like you, you've taken the time to build this relationship, we're going to give you this business. So it just bears fruit, but you have to put in the time and the work. It does take time.
All right. So we're going to shift gears a little bit. I want to talk about internships because of the complexity of this industry, and May's touched on it a little bit, and the topic has bubbled up a couple of times. It's an industry that takes a ton of experience and can take a little bit of time to get into. So talk about individually, and we can start with Amanda and May and work our way around. Talk about your internship programs, talk about your outreach to students and what that can look like or could look like.
I guess I'll go first.
Yes, please.
Yeah, so for internship wise, that'd be applicable to all of you would be our sales internship. It's in the summer, 8 to 10 weeks. Selling medical devices. As we mentioned, it takes a very long time to learn these devices. So we give our interns just a few to focus on so you can actually be proficient in a couple, really know those well to be able to sell them. We hire 3 interns for the summer. We're currently hiring right now. Kind of started the early rounds of interview process. So if you're all interested in a medical device internship, it'd be in Milwaukee. Apply immediately. Shoot one of us an email, talk to your professors if you need contact information, so we can get you on the short list and start talking to all you. In regard to like outreach, we come to events like this. I'm often at Whitewater for various career fairs or competitions. So we get a lot of good students from Whitewater in the past. Had an intern the last summer from Whitewater. 2 of our interns the summer before were from Whitewater, and they all did really, really well. Yeah, and with the internship, it's not like some internships where you're shadowing a sales rep to see how things are done. We have our sales trainer working with you in a week or two, and then we throw you out on the phones. You're calling, you're talking to doctors and nurses, which is pretty scary at first. Grant mentioned being comfortable, being uncomfortable, and that is a mantra that was shared from our sales interns this last summer with some exit interviews. So definitely getting outside of your comfort zone, and really doing the the real thing. You're doing the sales. You're putting up numbers. Our interns this summer crushed it. Like out ballpark was here and it went to a different one in Chicago. It's a really good hands-on experience if you're really looking to see what sales is all about and grinding every day. That's what the internship is. So if that's something you're looking to get into, it's a great internship to 1, get experience, 2, see if you like medical or not, and then 3, keep you on our radar if we have any full-time openings. We mentioned we're small to mid-sized companies, so we don't always have a guarantee for a full-time opportunity when you graduate. But that is one of the roles. Our entry-level role is one that is open more often than some of our other entry-level positions. So there is definitely a chance. So be sure to keep an eye out for entry-level opportunities as well.
Wonderful. May, opportunities for internships with your organization?
Yeah, absolutely. So this is our first year as a partner at UWW, but we actually, as it said before, actually have a few, I want to say 3 to 4 UWW alumni that is part of particularly our ISR team, which is based in Milwaukee. We this year, will be our second year that we have a full, pretty robust internship opportunity and program where we hired last year 2 marketing, 3 sales individuals, and similarly, you're going to be right out in the field. We actually, depending on your location, most it's going to be either based remote or based out of the Milwaukee or Waltham office. You'll be learning, you'll actually, for our sales team interns specifically, you're actually going to be certified in one of our products. So you go through the full program where you do at-home study, and then you come out to Waltham for 2 weeks. And you go through the entire program as if you're, one of our new sales teams, and then you're right on out, making calls, doing field rides, going to luncheons with our sales team as well. And then also doing a long-term study program as you're kind of leading up to your capstone project. But we understand that this is an internship program. We're bringing on students with a lot of interest in all different kinds of things. So we actually have a heavy focus on learning all different aspects of the company. So you're learning regulatory, you're learning quality, finance, compliance, just so that you do have, an understanding of what really pulls together an organization. And you're working with other interns cross-functionally as well with your other projects. So it's kind of a robust and all-encapped business how-to program, I guess.
All right. Fantastic. Grant?
Yeah, so I can't speak on the internship itself as far as an experience goes, because I did not have the opportunity, or at least I didn't take advantage of the opportunity to be an intern with Henry Schein. But Miss Gracie Hughes was an intern for Henry Schein this past summer. Madison Niasgoda, past president of AMA, was also an intern of Henry Schein, is now working for us full-time down in North Carolina. I believe we typically will hire 2 students for the internship in the Wisconsin, Chicago area, both 2 dental, 2 medical. If this seems like something that you'd be interested in, or if what I said today piqued your interest, please feel free. I'll be hanging out for a little bit at the end here. Feel free to come down, talk to me, ask questions. Otherwise, I don't know. I'm sure you guys hand out our contact information. Don't hesitate to reach out to myself or Miss Ashley. She's the person who's in HR who would actually be ahead of talent acquisition. But what I'd have to say as far as advice goes for the internship is, first decide, do you want something that's virtual or do you want something that's in person? I don't know how prevalent the virtual internships are anymore, but me being in college during the pandemic, it very much so was prevalent. So ask yourself that question first, and then I'd say, go from there. Build a pros and cons list of your opportunities that are ahead of you. But as Gracie can attest, you kind of thrown to the wolves. So if you're looking for real world experience, Schein's a great opportunity. You're talking to doctors on a daily basis, but by no means is it a account. We have our A, B, C's accounts. As an intern, you're probably seeing the Q accounts, low revenue accounts, but every account, as you guys should know, for any company and any industry, they should be treated the same. There's opportunity everywhere. So even though they're low revenue at the time, that means, if anything, that means there's more opportunity. So I'm sure Gracie would be gracious enough to answer any questions that you have about the internship in particulars. But yeah, feel free to stop by, talk to me at the end.
All right, thanks. Tyler?
Yes. So unfortunately, at Prent, we do not offer any internships. And the reason being is after you'd be completed with training and understand what you need to go out into the field, it would be way past the time of a standard internship. So we are, of course, always looking for new talent. We are looking for a full-time sales representative to cover a portion of the territory designated throughout the team. So that's, of course, you can feel free to come up and talk to Tyler and myself regarding that. Any December or summer grads, we're always open to see that new talent.
All right, so we are running out of time, and I always like to end these here. We'll start with Taylor because she's got the microphone and it's turned on. We're going to work our way down to Grant, and then we'll finish off with the three of you because you guys are the most recent graduates. The rest of you have a couple of miles on you like I do. So your advice will probably be different, but advice for soon-to-be grads and or college students now that you've been out for a couple of years.
Yeah, like Tyler and I said, we were both in your spot a few years back. So just you guys being here, honestly, I say is a great start. Really taking advantage of all the opportunities that Whitewater and specifically the sales program at Whitewater offers. It really truly provides such valuable experience prior to actually getting out into the sales, into your sales field. So take advantage of everything that is offered to you. And another thing I like to say is when you are at the stage you want to interview, you are also interviewing the company just as much as they're interviewing you. You need to ensure it's a good fit for yourself. It's a huge part of your life, 8 to 5, Monday through Friday, sometimes weekends as well, and nights. It's specifically for sales. So you have to enjoy it, be passionate for the product and the purpose of your company.
I would just 100% echo what Taylor said about your interviewing the company just as much as the company's interviewing you. As a student, specifically, if you are a junior or a senior looking to get an internship, get a job, actually ask questions. I don't know how you felt, but I went into my interview with Prent not knowing what we did. Somehow they hired me. Worked out well. Don't recommend that. But also just go out of your comfort zone, have conversations with the partners specifically. It seems like every other week there's an event where students can talk to professionals in the industry, and whether you're just meeting someone, handing them your resume, just asking them about their journey is the biggest thing. Also, just don't be afraid to ask questions. In the industry, especially the healthcare market, we've said you're not going to know everything. So asking people that have been there for a long time and building relationships internally is super helpful, and just always be looking and open to opportunities. You never know what's going to be out there. So always be open to that.
All right, fantastic. Grant, you're up next.
First piece of advice is be first, so you don't have to follow up people who are really good at talking about things. No, but in all reality, being first is big. I, for one, was a massive procrastinator. Sorry, Andy. Typically got it in before the deadline, but don't procrastinate in any aspect of your life. I was a person who'd kick the can, drag my feet. All you're doing is you're putting yourself behind. So be first, be eager, be adaptable. For sure. If there was one thing to walk away with, it'd be to be adaptable. Every industry, every position, it changes. And if it's not changing, it's probably not a place you want to be. Change is good. So you got to be adaptable. A year ago, we had a cyber attack. We pretty much went to the Stone Age as far as sales goes, and I was not here for that. So I had to learn a whole lot. I had to be adaptable. We just had a town hall meeting today. We're having a company shift as far as positions go. You just got to be ready to move with the environment, because if you don't, it's moving without you. So be adaptable. And then lastly, what I'd say is don't close any doors you don't have to. I kind of make the comparison to like cars.com. You know, the more filters you put on, the less results you're going to get. Now, you don't want to see everything necessarily. So if you want to filter your prospecting a little bit, that's totally understandable, easier to manage and not so overwhelming. But don't close doors that don't need to be closed. I mean, I initially was going to be a pre-med student. I had to take business stats twice. You think I could have been a pre-med student? No. What is that, 365? That class kicked my butt. But definitely not a pre-med student by any means. So I had to adapt. I changed. I found something else that I'm passionate about, and luckily ended up in the healthcare field. So in a way, I feel like I still kind of won in that aspect. But be adaptable. Don't close doors that don't need to be closed. Ask questions. That's a big one.
All right. Thank you. May, we're going to come up to you, and then I'll make my way back down to Amanda's like, I wanted to go next. May, you're up next.
Yeah, absolutely. I would say kind of to shadow what everyone else is saying is really just be curious, stay curious, be eager to learn, be open to learning all different things. For the younger, students in college, I would say, take the opportunities that you have to get internships at all different types of companies, all different types of industries. It's going to help you one way or another, because you're going to be relatable. And that's really what you're trying to do when you're looking for a job. And then for our students that are coming up, be open to all different types of opportunities. Don't be complacent. Don't get comfortable just at one company or one industry. Try different things when an opportunity arises. Keep your doors open, always be on the lookout, have a backup to your backup. And always, network, try and talk to different people about their experiences, and continue moving forward. When you're looking for companies, for me in particular, I was always trying to find a company that I personally can relate to. And, whether or not you're in quality regulations, HR, or sales, find your focus and find your direct line to the goal and mission of the company, because that's going to keep you passionate and that's going to keep you focused in your career path.
All right, fantastic. Amanda, you're up next, because I have a slightly different version of this for Tim.
Oof.
Unless Tim had something ready to go, but
That's okay.
exactly.
You didn't steal mine, actually. She touched on it a little bit. Well, like you said, you guys are here. That's a great step. And doing all these competitions and being involved in this club or AMA organization, that's awesome. So you're on the right track career-wise. But I would just say diversify yourself, even outside of just marketing and sales. I see resumes come in. That's most of what I do. I look through resumes a lot. So I'll see some that are just like, okay, I did this in business. I did this and this and this. I'm like, do you have a personality? So one thing that I'll say I learned from personal experience, again, I'm also in the same age group as these individuals. So when I was interviewing for full-time opportunities outside, like what was in my senior year, every single interview I got asked the same question, and about my resume, and it's weird. So I was involved in a number of different jobs or part-time opportunities, internships, things like that. That's not what they asked about. They asked about my involvement in the Ultimate Frisbee organization at my college. Everyone was like, what is that? That's interesting. Tell me more about that. So don't be afraid to follow your actual non-career interests as well. That's not a bad thing. I think it diversifies you. You can use your sales skills in those organizations, in those extracurriculars as well. And honestly, it just makes you stand out. It makes you different. Like, oh, this is kind of interesting. You had time for doing this and this. That makes you more well-rounded. And then, like we were saying earlier, sales is building relationships, right? So you're going and you're talking to a doctor. they're not going to buy from you the first time. But like if you go and ask them how their day was, what they did over the weekend, and find those personal interests that you can bond over, that's where the relationship, I think, at least in my experience, really takes root. It's not going to be bonding over a medical device. Let's be real. They're not like, oh, I love this so much. Yeah. And that's all you talk about. That's boring. That's surface level. So getting beneath that surface level and building better relationships by being a human and having a personality and having real interests will make you a more marketable student and marketable candidate going into the workforce. So that's my hot take.
Fabulous. Tim, you're more than welcome to answer this question, the same question, but a lot of students in here have been through my sales management class or other management classes. As somebody who has new hires reporting to him, how does that change your answer? Or what do you want new hires to know from a leadership role? Hey, I'm the person you're going to have to answer to. Here are the things I wish you knew when you got here.
Well, first of all, I interview students from a lot of other universities and colleges, and you'd be surprised at the amount that know about Whitewater and their sales competitions and how nationally recognized you all are. So that's a big shout out. Worldwide, it's good. I think the biggest thing is you have to be yourself. So being authentic. Obviously, with these sales competitions, you have a rubric and you want to follow it to a T. It's not necessarily going to be that way in real life. So I think the biggest thing is I always tell my folks, just read the room, understand how the customer is giving you different cues, different buying signals. Maybe they're telling you, today is not the right day. And then you don't force the issue because you could end up losing the sale or affecting the relationship, and you live to see another day, because that's more important than trying to just be so tunnel vision that all you care about is trying to get that sale, trying to get that close.
Hey, thank you very much. Thank you to our panel. Thank you to May, who is still with us, I believe. So thank you very much, May, for that, for all of the panelists that came out and your unending partnership. We really appreciate it. I'm going to kick it back to Gracie and Alana. I assume you guys will be sticking around a little bit if people have questions. So round of applause for the panel and we'll get going. Thank you. Thank you, guys.
Awesome. Well, before you leave, we have just a few more things to wrap up today's meeting. Hopefully you enjoyed it. But once again, thank you to our partners for joining us here today. And thank you, Dave, for hosting, moderating. We always appreciate it. You keep things fun. So there's the sign in if you haven't had it yet. But we want to quick announce our general member of the week. Hopefully. Okay, well, hopefully they're in here. Otherwise, they could be in the other room. Samir in here at all? Might be in the other room. So we'll find them. But yeah, and get the Padfolio. Yeah, brand new Padfolios. So if you're member of the week, you're pretty lucky. So we have some upcoming events still the rest of this week and the rest of the semester. It's homecoming week and AMA has been going to some of the events. We are going to play bingo tonight. And then tomorrow we're going to go to the talent show and watch together. And then we're actually having a tailgate on Saturday for it. There's also an event happening on Friday with the bonfire. But we're going to have an AMA specific tailgate for the football game on Saturday. And then some other events coming up. We have the interview gauntlet on November 12th. Wednesday the 20th is our next certificate. And then we have our AMA banquet on December 6th. If you're interested in attending the homecoming tailgate at all, go ahead and scan this. It's just so we can get a count for food if you haven't yet at any of the previous meetings. And then lastly, if you are an AMA and you want to attend this year's end of the year, we call it banquet. It was like a banquet. If you would like to attend, go ahead and fill this out as well. Otherwise, that's it. Come down to see partners if you have any questions, and have a nice rest of your week.